Hello everyone, this is Dale Urich again. This is my fourth video. I said I was going to update everyone about every week, so here it is. It's about 10 days since my last update. So anyway, I'm about 6 weeks into this whole cancer situation. So if you think back to February 2nd, it's now March 14th at 2:52. We had daylight savings time last night, so I'm sure folks are trying to get adjusted to the whole time changing thing. So anyway, just an update from this past week. Early in the week, really nothing going on. It was a normal work week for me. Thursday was a very busy day for me. I think last time I spoke to you guys, I said I had like 3 appointments. Well, the nurse did a great job, and actually I ended up with 5 separate appointments. So Thursday was another busy day. Started off the day at 8:30. I had to run downtown to about 40th and Leavenworth, to the dental office to pick up the dental trays that they made for, that I have to wear at night or whatever when the radiation starts. So that was a pretty brief appointment, 30 minutes in and out. Gave me the trays and showed me how to apply the paste and whatnot. So not a big deal. Short appointment there. From there, after lunch, I went to get a CT scan done, which was requested by my chemo doctor to make sure that the cancer itself did not change or move or whatever. So anyway, they did it with contrast, where they have to inject something in your system to make sure that it lights up or whatnot. No results from that, or I'm not going to hear of any results, I guess. They use it more for planning purposes. So I got that scan done right after lunch. After that, I went up the road 5 or 6 blocks on Dodge Street to another doctor's office and basically got a hearing test. It was an audiogram to give a base assessment for my hearing. Supposedly this is standard protocol for when folks get this cisplatin, the chemo drug or whatever, that there are slight risks of hearing damage or ringing in the ears, things like that. So basically what they do is they want to make sure that they know what the baseline is when you start, that you don't have any hearing issues, and then they will monitor it along the way. So had the audiogram thereafter. Took about 15 minutes. I actually got there early, got in and out. So that went fine. And actually, the one appointment I failed to mention is because the CT scan kind of went fairly quickly. I called up the guy that was running the clinical trial and asked if I could sign the paperwork. Kind of a formality. I know last week I told you I'm participating in the clinical trial. So he had the actual paperwork at a sign and date, and it talked about what a clinical trial is, and I'm not going to get paid for it. It's to help other patients in the future, and all of that. So I officially signed the paperwork to participate in the clinical trial. So I knocked that out as well. And then, like I said, went to the audiogram. So those are the first 4 appointments. And then to close out the day at 3 o'clock, I had kind of a new patient orientation education sort of thing. So it was actually with a nurse to go over the chemo process in and of itself. So she went over a little booklet that talked about all the side effects, the pros and the cons, and what to look forward to or not look forward to, I guess the not so fun part. So anyway, I got some phone numbers to call if there's any issues. And then at the end of the actual meeting, she took me to the floor in Methodist where folks actually receive the chemo treatments, which was pretty disheartening for me to look around and see all the people in the room, sitting in a recliner, getting the actual IV with chemo. But, the good news is hopefully the chemo is killing the cancer for them, as I hope it does for me. So sit in this room, there's only one TV. It's kind of an open space area or what, and they give it to you intravenously. Sounds like my chemo treatment's going to be anywhere from 2 to 4 hours. So pretty long sitting there, kind of letting everything run through your system. So they recommend bringing books, iPad, laptop, headphones, whatever to pass the time or keep busy. So that's what I'm planning to do. So that was Thursday. And then on Friday was kind of the big day. I think, and if you looked at the Facebook post, I kind of posted a picture of the actual mask that got made. So Friday afternoon was my radiation planning session. So I actually met with a planning person, and the good news is they actually nailed down my start date for when the radiation chemo will start. And the good news is it's going to start on the 25th of March. So I still have a whole week or 10 days to wait, but at least now I know the date or the line in the sand in which I can look forward to this. And also the end date she gave me was May 5th. So not only looking forward to the start date, but the end date. I actually have it in writing and things like that. So my treatments going forward when I start are actually going to be in the morning, which is what I requested. I'm a morning person and all that. So I kind of wanted to knock them out in the morning so I could come home and get back to work, do what I need to do. So the good news is they're able to accommodate my early morning sessions. One thing I didn't know about, which they kind of informed me, is that the chemo and the radiation treatments are done on the same day. I think I did say that, but it's actually going to be done day one. So the chemo treatments are every week for 6 weeks, and it's going to be on day one. So on March 25th, my system's going to get rocked with both of them, the chemo and radiation in one day. So the hope is that I don't have any effects of that, immediately and all that. I think Tanya's going to take me there for the first time and see how it goes. So, it's going to be on a Thursday. I'm not sure how it's going to work out for the weekend. There'll be any impacts or what. Me, I'm just happy to get it started and get the process moving. So, anyway, that's the update for this week. I know it's 6 minutes, probably a little bit long. I'm trying to see if there's anything else. There may not be another update for this next week. It's a normal work week for me, Monday through Friday. Don't have any appointments. It's kind of a dead week. So the good news is get back to normal, focus on my work and things like that. So, to end this one, I wanted to thank everybody for, all the Facebook messages, text messages, and all of that. I kind of personally stopped liking or commenting on those because Connor, my son, made a comment about, do you know that everybody, sees these things in Facebook? And I'm like, yeah, I get it. But, everybody can shut off the notifications if they don't like it. But, rest assured, I am looking at these things and reading everything that people comment. So I do appreciate your thoughts and prayers, and we will make it through this. So anyway, I'm going to sign off for now. We'll check back on my 5th session, probably in a week or 10 days. Anyway, take care. Have a good work week. Today's Sunday, so it starts tomorrow. Have a good one. See ya.